A recent Leadership Institute on Preventing Child Abuse and Neglect brought together state and local leaders who share a common desire to end child abuse and neglect in West Virginia.
We're very pleased that the number of child abuse victims in West Virginia and across the country is on the decline, because that shows that we know what's working. We've got effective programs like evidence-based home visitation that are making a difference. But the reality is that too many children are still suffering harm of adverse childhood experiences and abuse and neglect. And so we need more of these programs. And so we're real excited to have people here this week to learn more about these effective processes and strategies that we can implement throughout West Virginia to make sure that every child grows up safe and sound.
Event organizers celebrated the news that various state and national data sources indicate child abuse is declining in West Virginia as effective approaches such as in-home family education programs have expanded.
We need to keep up our momentum. We've expanded in recent years the number of services available to families and the ability for our communities to come together and build protective factors that support families. But we need more of that. We just have too many areas of West Virginia that don't have access to available services that support families or to make a priority on children. We know that the early years of a child's life, their brain development is evolving, and we need to support and nurture that because children are affected by everyone that's around them.
While child abuse is declining in West Virginia, the Centers for Disease Control and Prevention warns there is still a long-term impact of child abuse.
We also know that child maltreatment is associated with a whole host of immediate and long-term consequences. Physical health impacts like diabetes, coronary disease, lots of things that typically we don't think are associated with sort of early childhood experiences. But we do know that there is this connection between adverse childhood experiences such as child abuse and neglect and long-term health outcomes. So really, that's why CDC's mission is to really promote safe, stable, nurturing relationships for children, to promote healthy children and healthy adults.
Prevent Child Abuse West Virginia works to give children good beginnings by strengthening families and communities. This is done by implementing innovative strategies in the areas of effective programs, public engagement, and sound public policy.